I am Dr. Carey. I am a pediatrician in Ventura, California, and we are talking baby care. Today I'd like to introduce Mark Wormoth. Mark is a certified orthotist with Channel Island Prosthetics Orthotics, and he is here to discuss positional plagiocephaly, or in simple terms, babies who are born with misshapen heads. Welcome.
Yes.
Boy, they need another term other than positional plagiocephaly. It can scare the bejeebers out of anyone, I think.
Yes, it can.
Okay. As far as positional plagiocephaly, we're talking about little babies who, when they're born, their head just seems to be misshapen for one reason or another. And, well, there are reasons in terms of the way the skull is forming. We have different sutures among all the plates of the bones that may not have formed correctly and may be attached inappropriately. For this discussion, we're talking about those who seem to just be smushed in a way.
Yes, there's deformational forces that could have occurred intrauterine, where the deformation could have occurred. It can happen with multiple births. There's not a lot of space in there. The head's being pressed, could be in a breech position. Deformation can occur intrapartum, and it occurs postpartum as well. There's just deformational forces that are occurring. I can show you a sample here of what that looks like. I'll remove the helmet, cranial remolded, and here is kind of a sample of a head that shows that flattening that can occur, and this is on the left side. And basically we're seeing that this half of the head is shifted forward relative to the right side. So we have a broader area here. And parents will see it. They'll probably bring it to your attention. Often when they're giving them a bath, the head is wet, the hair lays down, they go, my gosh, something isn't quite right, you know, and they'll bring it to your attention.
When parents do bring this to my attention, I tend to focus a little less, personally in my office, I tend to focus a little less on the flattening of the back of the head, but I take a look at the baby from top down to see where the ears are in relation to one another, and I like them to be on the same plane.
Absolutely.
To what extent is that a reasonable way of helping to assess whether this is an issue or not?
That's an excellent approach. In our office, we'll see the patient, and we'll take anthropomorphic metric measurements.
There's a big word.
Yeah,
what does that
another
mean?
one. We'll take measurements of the head, circumferences. We'll take measurements across the head, anterior to posterior, side to side, and diagonal measurements. And these diagonal measurements will show us the difference in the head shape and gives us data to go by.
One of the controversies has been how much our back to sleep program to reduce the incidence of sudden infant death syndrome has actually led to an increased amount of children, newborns, having a quote-unquote misshapen head.
It definitely, since around 1992, when the pediatricians began the back to sleep program, the data has shown a dramatic increase in positional plagiocephaly. However, the advantages of the back to sleep program far outweigh this issue. This is non-invasive, simple compared to the SIDS problem.
Absolutely.
Yeah.
And that's really key to mention, that this has been a wonderful program to help reduce the incidence of a really scary event that can be fatal to a newborn.
We have our children in car seats, which have a hard back surface behind them. We have them in strollers with their head on a hard back surface. And so that also, I believe, is a contributing factor to this as well.
I try in my office to catch it very early. We're at 2 and 4 months of age. I'm taking a look at their heads, and I really like to get them for helmet placements by 4 months of age. But I imagine that there are times when it doesn't happen that soon.
Absolutely. Our goal and our treatment parameters are from 3 months to 18 months. Those are the months in which the head is growing. It's that growth within the helmet that gives us that corrective capability. Ideal is 4 to 8 months. We do not treat infants before 3 months. At that age, they do repositioning. In pediatrician's guidance, they want to set the baby back onto this higher point of the skull,
Right.
Change the pressure parameters. So ideally, we'd like to start at 4 months. That way we get maximum growth. That brain is growing, expanding into the skull. It's expanding the skull, and we can contain it with mild pressures and help reshape and remold that skull into a symmetrical shape.
There comes a point where all those bones start to fix a little bit more.
Yes.
For children who this is not addressed after 12 months, do you really see a grand change, or are you just trying to minimize things?
We do see a change. We do not see a lot into the 12-month range. We've had some at 14, 16, and a lot of it has to do with the development of the child. We did have one child, actually at 2 years, the father wanted to go and get a helmet. But it was a very petite, small child, so I don't think his growth development. So we were successful at that age group actually seeing improvement. So a lot of it has to do with the development of that specific child.
Now, I like to have them treated not because there's anything that's going to affect brain developments. Even if a child doesn't have a helmet placed on them, even if we don't straighten the head, they're still going to develop fine. They're still going to do all the things they're supposed to do. It's not going to affect intelligence in any way. It's purely cosmetic.
That's a good point. The brain, it's not impacting the brain's development and functionality. There are concerns about the deformation that's occurring with the skull, that it can impact the mandibular aspect of the face, and so the joint positioning of the jaw. There are concerns about the vision, if it's extreme, the displacement of the face right to left can impact the visual field, possibly in the future. So there are concerns of that. There aren't a lot of definitive studies,
Right.
but there are concerns that those things could occur.
I also am concerned because right or wrong, as a society, we tend to subconsciously judge people by symmetry.
Yeah.
And we don't necessarily notice it, but when someone has an asymmetric quality, we put a judgment on that.
Yes.
And trying to correct that helps with one's self-esteem down the road if they're not aware that that's what's leading to the negative effect on them. So I guess that's one of the reasons why I try to make a good point of checking for symmetry.
It's a molded plastic with a foam liner, has a Velcro closure, and we build into the helmet corrective parameters that we want to achieve with the child's head shape. So, and it just comes on and off. The goal, it's easy to clean, maintain. The goal is to have them wear it at 23 hours a day.
For how long?
The average data is 4.5 months, but anywhere from between 3 and 6 months. 100% success when the patients are compliant in the utilization of this orthosis.
Well, again, I think this is a remarkable technology. I think it's really nice that we're able to make a change which can have such long-lasting positive impact on a person well into adulthood. And I thank Mark for joining me in discussing this common problem. I am Dr. Carey, and thank you for watching. For more baby care education and to sign up for our free newsletter, please visit us at drcareys.com. And remember, at Dr. Carey's, we teach baby care.
Breathe in, breathe out. Breathe in, breathe out. Okay. Let me see your ear.